it does impact the amount of supply that's out there. They're doing everything they can now. We're working with them to try to make sure they ramp up production.
Oh, FDA to the rescue. FDA is working with a company to try to ramp up production. Well, thank you very much. FDA, you caused the problem unnecessarily. You caused the baby formula shortage in the country. Your own website and the CDC website say that infection in the children did not come from the formula from that plant.
It wasn't my fault!
And now you're the heroes. Oh, we're working with them to try to increase production. By the way, when the shortage occurred and there was a crisis in the country, then all of a sudden, miraculously, FDA realized that the plant could open up again.
What a sham. What kind of a show are you guys putting on here today?
Something doesn't smell right here. Something's foul.
That's not been enough. Now we're working to try to bring in supply from abroad. FDA, which has to make sure that it's safe to bring from abroad, is working closely with the manufacturers so that there's little delay in getting it from a point outside the country into the U.S., into the hands of parents.
So I've learned a lot more about baby formula now. When I had a baby who drank formula, all I cared about was that it was available when she needed it. But to the point that you just brought up, now we're learning that there are really just a handful of manufacturers in this country. And when one goes down, it's a big problem. But also specifically with Abbott, it was shut down in February. And there's an ongoing investigation. It's not even really clear that the bacterial contamination that led to the shutdown is actually connected to this particular facility. And so I wonder, Secretary, if it's time to take sort of a bigger picture look at formula manufacturing and regulating in this country. Do we need to make some big changes here?
Oh, touchdown, score!
It is caught! Miraculous!
We're not worthy. We're not worthy.
We're not worthy! We're not worthy!
The mainstream media asked the question. He said it's not clear that the infection that killed these babies even came from the Abbott facility. Don't tell me it's not clear. The FDA's website and the CDC investigation found that the bacteria that killed the two babies are not even the same as each other, let alone they're not from the plant. The mainstream media, they asked the question. Yeah, This is now a reporter. She's on her game. She asked the question. So let's now focus on the question, folks. Question is, she's saying it's not clear that the contamination even came from the plant. So now will the Secretary of HHS who reports directly to the president as a member of the cabinet, will he now address the fact that the product that Abbott put out was not contaminated?
I'm pleading the fifth until I speak to my lawyer.
Oh, you're pleading the fifth, huh?
And FDA is trying to bring in product from outside, from other countries. Well, since the children that got Coronabacter infection did not get it from the formula of the plant, they got it elsewhere. Where? As I showed in my other video, my last video on this, I showed you it's everywhere. It's on your sink, it's on your countertops, it's on vegetables, it's all over the place. So what's going to happen, by the way, when more kids get Coronabacter infection and they took formula that came from outside plants? We're not going to blame FDA for that? So anyway, here's the issue. It's not clear that the infections came from the manufacturing plant. What does the Secretary of HHS have to say to that?
I'm with you. We don't have the authority at FDA to even request that companies tell us what their plants look like inside. We have to go in and inspect them. And if we find something, then we have to be able to prove in court that there's a reason to shut them down.
So the person doing the interview, she says the bacteria that affected the children did not come from the plant. So do we need a change in the way the FDA works? What's the secretary say? It should be, by the way, FDA should be held accountable for making false inspection. FDA inspectors, are they incentivized to write up violations that may not really be there? Should FDA be shutting down a plant when there's no contamination in the product and it's essential? What does he say? No. He says the opposite. Oh, I agree with you. He said FDA needs even more power. He says we don't even have the right to request that we get information on what's going on in the plant. We have to go in and inspect the plant. As I showed you, there's FDA inspectors all over the country. The FDA inspections occur, I showed this in the last video, they occur from the district offices. FDA has no problem going in and inspecting plants whenever they want to. The problem is which I've experienced also, the FDA went in and wrote up inspection results and shut down this plant, or forced the plant to shut down and forced the plant to recall when the data shows there was no problem with the product. That's the problem. And this guy's trying to turn it into, oh, the problem is we don't have more power. You exercise too much power.
Don't blame me. I didn't do it.
And you exercise it incorrectly, which I've experienced for decades. But he wants to turn it now. It's only the government, only a politician could turn his mistake into a reason why he should have more power.
We got Abbott in this case to voluntarily shut down because I think they saw what we saw. But it is crazy to believe that in the 21st century, we don't have the authority to really get the industry, a very consolidated industry, to tell us what things are looking like inside. We have to wait till a problem occurs.
Oh, so he says in this case, they got Abbott to shut down the plant because Abbott saw what FDA saw. Excuse me, here's the truth. Again, I showed it in the last video. Abbott's statement said that there was never any contamination of the Abbott batches. The formula went out to babies. It had no contamination in it. The samples of each batch that are kept at the company were tested. They don't have Chronobacter in them, and the Chronobacter species that affected the children is not to be found anywhere in the manufacturing plant. It goes then about the word voluntary again. He's trying to push the blame off onto Abbott when the FDA came crashing down on Abbott, and the FDA caused the baby formula shortage, and he's trying to do everything he can to run from it and push it onto Abbott when FDA made the mistake. As I told you in the last video, one of the most important lessons in life is if you make a mistake, just say you made a mistake. Own up to it. Take corrective action. Not the government, at least not in this case.
So I'm curious, though, the plant has been shut down for many, many months. It's not until there was a lot of sort of media attention, a lot of outraged parents, and suddenly it seems like the plant's ready to reopen in a handful of weeks. People are going to wonder, how does that work?
The mainstream media, this reporter, this interviewer, this hostess, she is on the ball. She's saying you had to shut down the plant because it was, killing babies. And now all of a sudden, when there's a national uproar and children are going to be hospitalized or are hospitalized because they can't get formula, all of a sudden the plant can open up again. How does that work? In other words, you messed up. FDA, HHS, you messed up. You shut down a plant that was not contaminating anybody, and you've caused a problem. And now all of a sudden, when there's all this national attention on you, miraculously the plant can open up. How does that work, she's asking. How does that work? Now let's see how a politician who wants to try to weasel out of responsibility, let's see how he responds.
Well, fortunately, the plants in the U.S. operate in a way that keeps them, for the most part, clean and safe. It's whether they are staying on top of what they're doing to make sure it's clean and safe.
Oh, so he's not saying that the product was contaminated now. He's saying the issue is how well the company stays on top of making sure that the product is clean and safe. Now, this is called CGMPs, Current Good Manufacturing Practices. And companies, we spend an enormous amount of money, time, effort, people constantly on this to further assure the quality of the product, to standard operating procedures, training, cleaning procedures, chemical testing. We do all these to assure that the product will be safe. So now he's kind of acknowledging, without saying it, that there was no problem with the product itself. FDA didn't like the level of assurance that the product would be safe. But then why did you shut down the plant, causing children to be harmed when there was no harm? It just wasn't the level of assurance that they won't be harmed that you were not comfortable with. So therefore you go and harm them?